Welcome to Magnolia's Home Care Annual Training. Today we're going to go over HIPAA, scalding prevention, superbugs, and hand washing. HIPAA privacy keeps personal health information in any form, oral, written, or electronic, private. HIPAA security, with the compliance date of April 2005, is the next phase to safeguard personal health information in electronic form, or EFI. The security rule. The security rule protects medical records in the world of high-speed technology. It protects the confidentiality of EFI in that sensitive information can only be used by authorized individuals. It protects integrity. Once EFI is created, no one can tamper with it. It also protects the availability of personal health information, even if the software fails. Proper disposal of FI. Remember, FI comes in many forms: administrative documents, reports, restraint logs, weekly wound or skin logs, not just medical records. If a resident can be identified or linked to any information in the document needs to be protected. It must be discarded according to your facility guidelines for FI. Use and disclosure. Assign authorization from the resident or his or personal representative is required to use or disclose FI and psychotherapy notes. The exception is when FI is used for treatment, payment, or healthcare operations. Signed authorizations cover only the use and disclosure outlined in that form, and they have an expiration date. After the date, you are required to get a new authorization. The privacy rule gives individuals the right to revoke any authorization they have previously signed. Use and disclosure continued. The revocation of authorization must be in writing and clearly state the individual's right to revoke. Check your facility's privacy practices to find out more about what you're required to do. Documentation is required when a request is made for use and/or disclosure of FI, even if it is refused. Release of resident information. Privacy rule permits you to notify family members, personal representatives, or others responsible for care about the resident's location, general condition, or death. If the resident is present and capable of making decisions, you are required to get his or her verbal agreement. You are allowed to use or disclose FI without written authorization, but you must have the resident's verbal agreement. In all situations, use your professional judgment. Incidental disclosures. The privacy rule does not prohibit common healthcare practices called incidental disclosures, including the following: medical chart left outside of the exam room. Make sure that the area is supervised. High-risk fall. Sign placed next to a resident's bed. Discussions between healthcare providers in a double room with the curtains closed. Talk in lowered voices when permissible. You are required to take reasonable safeguards to protect the individual's privacy. Facility security. Physical security begins in the parking lot. If you see anything suspicious, notify security immediately. If a vendor comes to the facility, check for ID. If there is no ID, escort to the proper destination. Make sure laptops or PDAs are secured and hidden when carried to your vehicle. Never share your password to fix a computer. Sharing passwords is a serious security violation that will result in immediate termination. Facility security continued. Remember, viruses can enter your computer through external floppy disks or CDs not approved by IT. Never download or use software given to you. All software must be approved by IT. Email attachments are the most common way for viruses to infect the network. Never open attachment unless you know who sent it. If you see a virus warning, report it to IT and your supervisor immediately. If your password doesn't work and you can't access your files, report it to your IT department. When a person is terminated, take steps to lock that person out of the systems immediately. If they need to get personal files, provide supervision by an IT person. What you need to know about hand washing. Hand washing. Hand washing is prime of importance in reducing pathogenic germs. As an employee of Magnolia's home care, you have direct control over the spread of microorganisms by how concerned you are with your personal hand washing. Hands spread more germs than any other part of the body. Hand washing doesn't stop there. If you are coughing or sneezing, you should wash more frequently. Likewise, if you work around someone who is sneezing or coughing, or you think you may be sick, you should wash after any contact with that person. Remember, not to touch your eyes, nose, or mouth until you have washed your hands. When are you supposed to wash your hands? Before preparing food, before eating, before applying makeup, before handling contact lenses, after preparing food, after you go to the bathroom, and after changing diapers. Here are the hand washing rules. First, hold your hands under warm running water, not hot water, which causes dermatitis. Once your hands are thoroughly wet, lather up with soap. Liquid or bar, whatever you have will do. Now, start rubbing your hands together. Be sure to get the back of your hands, fingernails, around rings, and wrists. Rub your hands for at least 10 to 15 seconds. Rinse with fingers facing down into the sink. Dry your hands with the water running. MRSA or MRSA and VRE precautions. Battling superbugs. The problem of antibiotic resistance in MRSA. When given antibiotics, bacteria in the body have the opportunity to adapt. Some are killed by the drugs, but hardier bacteria survive by acquiring a resistant gene that allows them to overcome the antibiotic. These genes multiply 1,000,000-fold in a single day. Two major organisms of concern is MRSA. It is found in hospitals and long-term care nursing home facilities, especially those with weakened immune systems. The problem of antibiotic resistance and community-acquired MRSA. Community-acquired MRSA is on the rise in communities affecting otherwise healthy people. It is outwitting the immune response than more common staph strands, but combines resistance with virulence. Community MRSA is spreading in contact sports and crowded living areas, such as military barracks, prisons, and homeless shelters, as well as daycare centers and among IV drug abusers. The problem of antibiotic resistance in VRE. Community-acquired MRSA and MRSA cause physicians to treat patients with a more potent antibiotic, usually vancomycin. As a result, strands of bacteria called VRE become resistant to vancomycin and many other antibiotics. In some cases, they resist all standard therapies. The leading cause of healthcare-associated bacteremia is VRE. VRE is transmitted by direct contact with stool, urine, or blood containing VRE. Those at risk for VRE are patients with weakened immune systems, those previously treated with vancomycin and other antibiotics, hospitalized patients on long-term antibiotic therapy and undergoing surgical procedures. Patients with indwelling medical devices such as urinary catheters or central intravenous catheters. Preventing transmission of MRSA and VRE. Facilities reduce MRSA by early identification and colonization. Success comes from admission screening, plus screening of high-risk patients, such as roommates of infected patients and those admitted to high-risk areas. The best ways to identify infected patients is to take stool cultures of rectal swab cultures to determine the presence of VRE. If MRSA is suspected, obtain a lab culture from the infection site. If staph is isolated, It is tested in the lab to determine which antibiotics will be effective for treatment. VRE and MRSA can survive for weeks to several months on various surfaces. The best way to stop the spread of both MRSA and VRE is to follow isolation precautions for all high-risk patients. The best way to prevent body site cross-contamination is to wash hands between same patient procedures. Here are 8 health reasons you should call 911. Chest pains or pressure, difficulty breathing, uncontrolled bleeding, severe abdominal pain or pressure, loss of consciousness, seizures, trouble speaking, and thoughts of suicide. Here's a list of reasons to call 911 due to medical incidents. If someone may need psychological support, is having a nervous breakdown, fall, chokes, or having convulsions, coughing or vomiting blood, a heart attack, stroke symptoms, severe headache, diabetic coma, and amputation of any finger, toe, or limb. Do not call 911 for the following: to ask for directions, to report a medical situation that is not an emergency, or to give false alarms. We have concluded our annual training with Magnolia's Home Care. Please see administration after completing your quizzes using the links below. Thank you.